pursuant to Standing Order number 81-4, main estimates, 2012 to 13. I want to welcome the Minister of Health. We're very, very pleased we have the Minister here this morning. And so, Minister, I would just like to give the floor to you, and we look forward to your talk this morning.
Good morning, everyone, Madam Chair and members of the committee. It's a pleasure again for me to be here to discuss the supplementary estimates C as well as the main estimates for the health portfolio. But before I do that, I would like to introduce my officials that are here with me this morning, many that you already know of. With me is Glenda Yates, the Deputy Minister, Department of Health, and Dr. David Butler-Jones, Chief Public Health Officer for the Public Health Agency, Paul Glover from Health Canada, Health Products and Food Branch at the other end. But before I begin, let me say a few words about the important debate that took place last night in the House, and I believe most of you were there. Being able to explain the different roles and responsibilities with respect to the drug supply was important for me to get across and emphasize we are responsible for access to drugs using the highest standards of safety and efficacy. We provided guidance and insight to the purchasers, namely the provinces and the territories. But our government is extremely respectful of their jurisdictions. Provinces and territories are responsible for the delivery of health care. They know the needs of the Canadians who live there. They know what drugs are consumed and in what quantities. They know what to order when entering into a contract with pharmaceutical industry. They also know whether their supplier is a single source for drugs they order, and it is up to them to ensure that there's a plan B. They are also responsible for the terms of these contracts. As I stated, I wrote to industry last summer and requested that they take the issue seriously. They have responded and are setting up websites that will inform provincial and territorial and their healthcare professionals of impending drug shortages. In fact, just yesterday, I heard from Sandoz officials who responded to my letter in a very positive manner, and they have agreed to post information about drug shortages online and gives 90 days notice of any other drug shortage that will arise in the future. And this is very encouraging, and I hope that they will live up to their commitment. This is far from being a Canadian issue. We work with our global communities to alleviate any stresses on our system, as we witnessed during the isotope shortage. We will continue to provide our jurisdictions with the support and guidance they need, as always. I'm pleased to be invited here this morning not only to discuss the supplementary C and main estimates, but to also update members on progress made in the health care portfolio. As the need of Canadians change, so do the demands on our health care system. In many of our discussions I have had with my provincial and territorial minister colleagues, there are two issues that are always acknowledged. Firstly, that there is a keen interest to provide information to Canadians regarding healthy living and healthy lifestyles. Maintaining a healthy weight and healthy diet, as well as doing regular exercise, will ensure that the number of health-related issues in this country, including chronic diseases, will also go down. This will have a significant impact on the province and the territories in the delivery of health care to their jurisdictions, as the number of doctors' visits would decrease, as would the number of hospitalizations. Secondly, the provinces and the territories are keenly aware of the fact that they will need to be more innovative and realize that they need to adapt the system in their jurisdictions to the needs of their citizens. And the emergency room is not always the Band-Aid solution. One of the ways we have made much progress and that we are very proud of is the creation of a new model of health governance for First Nations in British Columbia. Most recently, we hosted an important meeting between the Crown and First Nations that included important discussions about health care as well. In the months and years ahead, the sustainability of our healthcare system will be recurring subjects of our discussions, and I suggest, Madam Chair, that sustainability will come up from innovation and cooperation. Providing Canadians with the information they need to make healthy decisions for their loved ones is key to optimum population health. Madam Chair, since I was named Minister of Health, I have continued to work with my provincial and territorial colleagues towards a more sustainable healthcare system that achieves better results. Our government is committed to strengthening the healthcare system, and we have delivered on our commitments under the 2004 Health Accord. We have made progress in reducing wait times, increasing the number of doctors and nurses, and introducing electronic health records. Since 2006, the federal health cash transfers have been growing at a rate of 6% annually. In 2011-2012, we provided $27 billion to the provinces and territories through Canada Health transfers. By 2013-14, it will be more than $30 billion. It will reach $40 billion by the end of the decade, and our government has been clear that we will not cut health transfers. Last November, I met with the health ministers in Halifax, where we discussed healthcare priorities and challenges and our common focus on the healthcare renewal. In December, the Minister of Finance announced long-term federal funding for healthcare beyond 2014. The growing funding guaranteed governments can focus on healthcare renewal. I have already met with several health ministers to talk about ways we can work together to ensure a more sustainable health system. And I believe there is a great deal of will to work towards this common goal. As the jurisdictions responsible for the delivery of health care, it is up to the provinces and the territories to decide on the direction and the pace of change for their own health systems. I am interested in working with them to see how federal tools and levers can support them in their reform to improve health care, and I continue to dialogue with my counterparts on a regular basis. Innovation comes from rethinking what we do. We need to analyze every aspect of healthcare to see whether it is delivering what it should and whether it is being done efficiently. We invest our over $1 billion annually in innovation through the Canadian Institute of Health Research, Canada's Health Infoway, the Canadian Agency for Drugs and Technologies in Health, and other programs that support research, health human resources, and the assessments of technology. The Canadian Institute of Health Research is leading research in many areas. For example, the CIHR is funding research into the way we deliver primary care through family physicians, nurse practitioners, pharmacists, and other frontline services. We can see the day when medicine is personalized or tailored to the needs of the individual based on their genetic profile. It is the next step in the evolution in the way we treat disease. Right now, we treat disease based on what we know about the disease. In personalized medicine, we will treat the disease based on what we know about the disease and what we know about the person. Treatments that are tailored to the patient will be more cost-effective and, more importantly, mean better health outcomes. To get us closer to making that a reality, we are working in partnerships with Genome Canada, the Canadian Institute of Health Research, and the Cancer Stem Cell Consortium to invest $67.5 million in research for the development of personalized medicine. While we are creating new models of healthcare delivery, we are also working to prevent as many health-related problems as possible. We already know that unhealthy weights can lead to many health problems, and we know that there is a growing problem of overweight and obesity, especially among our children. To reverse that trend, we will need to help the help of individuals, industry, and organizations that can help create the conditions that lead to healthier eating and more active lives. In September 2010, I was proud to join my provincial and territorial colleagues in endorsing the Declaration on Prevention and Promotion and Curbing Childhood Obesity, a federal, provincial, territorial framework for action to promote healthy weights. In September of last year, I added my signature to the UN Declaration on Prevention and Controlling Chronic Diseases, and the role of active living and healthy eating in preventing chronic diseases like diabetes and heart diseases is highlighted in the declaration. A few months ago, my provincial and territorial colleagues and I endorsed the recommendations and key areas of action that can be taken by government to support healthy weights and reduce childhood obesity. But governments alone cannot address the growing obesity epidemic. We all have a role to play to promote healthy weights and help our children get the healthiest possible start in life. I recently co-hosted a summit on healthy weights with my colleague from Nova Scotia, and this summit brought together a variety of sectors, industry, the voluntary sector, and governments, and in my view, this was a historic event. We challenged everyone to think outside the box and to build partnerships for collective action. We are also developing partnerships with a variety of organizations, and those bonds will serve us well in combating obesity in order to reduce the incidence of chronic disease in this country. Regarding HIV/AIDS, and in order to speed up the pace of research, we are funding 5 major research projects that will drive the development of a vaccine. These projects represent an investment of $17 million. They are the kind of research that will bring us closer to finding a vaccine and that will foster the next generation of HIV researchers. As well, Madam Chair, to help administer and guide future research, we are providing funding for the creation of the Canadian HIV Vaccine Initiative Research and Development Alliance Coordinating Office. It will be funded for the next 5 years by the Government of Canada and the Bill and Melinda Gates Foundation. It is an additional investment of $3.2 million and is an important part of the Canadian HIV Vaccine Initiative. Our government has been very proactive and serious about ensuring the health and safety of Canadians. And as you know, there have been important changes with the passing of legislation such as the Canada Consumer Product Safety Act. The Canada Consumer Product Safety Act has given us new tools to improve the safety of products in the marketplace. It is an important legislation that has helped us to protect Canadians from dangerous products. In fact, in late December, our inspectors found children's jewelry being sold across Canada, which had high levels of cadmium and lead. Backed by the new authorities in our Act, we were able to work with the companies involved to accelerate the removal of these products from the shelf. Another area we have been working on is the traditional Chinese medicine. While many Canadians look to modern medicine for treatment, many others use traditional Chinese medicine to maintain or improve their health. We want to make sure those products are both safe and effective, and to get input from those who are most knowledgeable about them. Late last year, my Parliamentary Secretary, Colin Carey, and I hosted a roundtable discussions with practitioners and representatives from industry in Toronto and Vancouver. The face-to-face discussions were very useful from both point of views. We appreciated their input and they appreciated being heard. This has inspired us to create a TCM advisory committee to provide advice on emerging issues related to traditional Chinese medicine. Also making headlines in recent months has been the debate on MS and CCSVI. I want members of this committee to know that the government shares a desire of MS patients to find a cure for this disease and to better understand the procedure proposed by Dr. Zamboni. That is why we are funding research on MS, and to date, the government through CIHR has invested $55 million in MS research. In partnerships with the MS Society of Canada, the Canadian Institute of Health Information, and the networks on MS clinics, we are building a Canadian MS monitoring system which will become a valuable source of information for patients, doctors, and researchers on MS. CRHR is also currently selecting a research team to conduct a clinical trial on the proposed procedure, and this research initiative is being conducted in collaboration with the provinces and the territories and key stakeholders, such as the MS Society of Canada, to determine whether this new procedure is safe and effective. And these are important questions. These important questions have not been answered unequivocally by the international research community. Our clinical trials will provide the answers we seek. It is also our role to move forward on this important health issue without putting the lives of Canadians at risk. In conclusion, Madam Chair, healthcare is a priority of most Canadians, and I know each member of this committee share the desire to provide Canadians with the best tools we can to lead healthy lives and access the best health care that can be made available to them. So I'd like to thank the members for your hard work, and if you have any questions, I would be pleased to answer them this morning. Thank you, Madam Chair.
Thank you, Minister, and we so appreciate you coming today. We're all looking forward to this time with you. We'll now begin our Q's and A's, 7 minutes. Ms. Davies.
Thank you, Madam Chairperson, and thank you, Madam Minister, and to all the officials who have come here today. We appreciate you making the time, because obviously we have many important issues to discuss, some of which you've raised in your comments today. Thank you also for being at the debate last night, the emergency debate that we had in the House. I think there is a fundamental question about why the voluntary agreement around drug shortages is not working. So I hope that we'll have further discussion on that, because clearly the approach that the government is taking has not solved the problem, and we have quite a crisis before us. I do want to focus on 2 questions today to do with healthcare funding and also regulating processed foods. So if I might, I'd like to put the 2 questions to you. On the first one, I think, Madam Minister, the Premiers have made it very clear that they expect much more from the federal government than a non-negotiable funding package. In fact, the Premiers have repeatedly called for a collaborative healthcare funding process which would uphold the commitments of the 2003-2004 Accords. Despite what you say in your comments today that those commitments have been met, there's still a long way to go even to uphold the 2004 commitments and to ensure accountability. It's very interesting that the responses of the government has been this unilateral decision. We know that you sent a letter to the Premiers, but there hasn't been any significant process. There hasn't been any meetings jointly other than the one that took place last year. And so I think there's a real question here about where is your leadership on this issue, because that's what Canadians expect. Why is the federal government and why are you as Minister walking away from this collaborative and joint process with the provinces and territories? My second question has to do with processed foods. Not only have you walked away from talking to the provinces and territories about healthcare funding, but you've also not acted to reduce salt, sugar, and trans fats in our food, despite repeated calls from healthcare organizations and practitioners. You might know that the British Journal of Medicine singled Canada out as blocking an international agreement to reduce salt, sugar, and trans fats in processed food. And it was recently revealed that you personally ended a plan to reduce trans fats in processed food. So the question I've got is, why are you continually siding with industry rather than looking out for Canadians trying to make healthier food choices?
Minister Kluka.
Thank you. Just on the issue of, first I'll start with the transfers to the jurisdictions and under the health accord. Under our government health funding plans, and we've increased the transfers to the jurisdictions. And I stated before many times, I was at the table when cuts were made to healthcare transfers. I was finance minister for Nunavut at the time when significant reductions were made to education and health. What our government has stated time and time again is that we will not cut transfers, and the finance ministers met in December and basically outlined the funding beyond 2014. The funding that's gone to jurisdictions is predictable and sustainable, and each jurisdictions can now focus on health priorities. Since that time, I have had a number of meetings with provincial and territorial health ministers to talk about beyond 2014, looking at innovative ways to look at where we can make improvements in the delivery of health care, and I've outlined those in my opening remarks to the committee this morning. And I will continue to meet with my provincial and territorial counterparts in health to really have a discussion on health care, which was not the discussions in 2004. The health accord was about funding at the time, and it had nothing to do with what are the health indicators that this country should be focusing on, and that's precisely what I'm doing with the jurisdictions around the issue of priorities for Canadians. In the area about sodium and trans fats, we continue to move those areas and move forward with those areas. Like any other program, there's always recommendations that come forward in a number of options, and a number of options are always laid out and in any initiatives, and collectively we've had some discussions around now with the federal, provincial, territorial health ministers, and I'll use sodium as an example. For lack of better words, there's 10 ways to skin a cat, and there's different ways we can get to the outcomes that we're looking at, and I think what we're doing right now to reach those targets, it is progress in the right direction. Secondly, we cannot deal with the health of Canadians by ingredients at a time: trans fat, salt, sugar, whatnot. We need to look at a broader strategy in keeping population healthy in Canada. That declaration was signed off by health ministers, federal, provincial, territorial health ministers in Nova Scotia on building healthy Canadians, and particularly combating the issue of childhood obesity, which is an epidemic now. In my opening remarks, I stated that we had a historic meeting which brought in a number of sectors, the food industry, the healthcare professionals, the volunteer groups, and whatnot, to look at how do we deal with this very issue in a broader scale. And we cannot deal with the health of people, like I said, by ingredients at a time. It has to be much broader than that: physical activity,
Madam Minister,
obesity,
just on the issue
and a number of
sodium,
areas. So
it was your own
forward.
panel of experts who made these recommendations. The provinces were in agreement. So I think the issue here is that this debate has gone on forever. There have been very clear expert recommendations made. It's your government that is now holding up the agreement. We know from the British Medical Journal that it's Canada that blocked the international agreement on a number of issues, whether it was salt, sugar, or trans fat.
Yeah,
so
that's
the question. Why is your government blocking these agreements and not listening to these experts who and the provinces
Your time
who
is
have
up,
come
Ms.
to
Davies.
agreement?
Thank you very much. I will now go to Dr. Carey.
Thank you very much, Madam Chair, and I wanted to take this opportunity to thank the Minister for being here. You've been very busy the last little while, and we do appreciate your time coming to this committee to answer our questions. You mentioned in your opening statement about traditional Chinese medicine, and I want to thank you for allowing me to participate in our roundtables. We all know that Canada is changing. Canadians want choices. I know in my own community of Oshawa, I had the opportunity a while back to talk to an Afghan veteran who had an eye problem, and he came back home. He tried everything to find a cure, find help for his eye issue, and his brother sent him to a traditional Chinese medicine practitioner, and within 2 weeks, his eye cleared up. And I was wondering, with Canadians looking for more choices like this, you've taken a leadership role, talking and listening to different communities. I was wondering if you could explain to us why you decided to set up the Committee for Traditional Chinese Medicine, and what's it going to do for Canadians?
Thank you for the question. The traditional Chinese medicine, also known as the TCM, are a type of natural health products that Health Canada regulates. There are over 1,400 of them available for sale in Canada. Our government recognizes the unique nature of TCM and want to hear from the community's view on these products. So my officials meet regularly with representatives of this industry. But we also held 2 dedicated roundtables in Vancouver as well as Toronto last fall to hear back from the TCM stakeholders. Based on what I heard at those discussions, I called for the establishment of a TCM advisory committee, and this committee will provide a single window for TCM community members to interact with my department to bring their views and concerns forward. The advisory committee is being established in recognition of the unique characteristics of TCM. It also acknowledges the concerns that we heard, concerns of the TCM community about the appropriateness of the Western medicine model for these products. And the mandate of the new committee is to provide my department with advice on current and emerging related issues on TCM, including the importation, the sale, and use of TCM as well in Canada. So potential members have been identified from a cross-section of key stakeholder groups, including the industry, TCM practitioners, consumers, and patient groups. And the advisory committee will have their first meeting sometime this spring, and I'm looking forward to hearing their views on this very important issue. Thank you.
Me too. Because, like I say, Canada is changing. We're also seeing a huge demographic shift. I'm part of the baby boomers, and I think this year they said it's the first year that baby boomers are turning 65. And we've just finished up a study here in Health Committee on chronic diseases and aging, and we heard a lot about our healthcare system and how it evolved into acute care system, and it seems we're going to be having to shift into a more chronic care system. We heard the expanding incidence of things like diabetes, heart disease, arthritis, and how many of these conditions are preventable. I was wondering if you could tell our committee what the government is doing to help prevent these chronic diseases in Canada.
Our government understands the burden that chronic diseases place on the Canadians and the healthcare system. And as I stated in my comments, that we are committed to reducing their impact. We are helping to create the conditions for healthy aging by preventing and delaying the onset of chronic disease. We are also helping to prevent the complications when those disease occurs. This is achieved through a number of federal investments, initiatives that allow us to better understand the wide range of factors associated with aging. As an example, we launched the $15 million 4-year National Population Health Study of neurological conditions in collaborations with Neurological Health Charities Canada. And again, this study will cover a wide range of neurological diseases such as Alzheimer's disease, dementia, and Parkinson's. As well, the CIHR, through the Canadian study on aging, will examine health and social economic issues of Canadians aged 45 to 85 over the next 20 years. In addition to filling knowledge gap, our government is working with a wide range of partners to provide information and tools to promote healthy aging and prevent chronic disease. Preventing chronic disease and promoting healthy, active living are themes that cut across all of our disease strategies, including the Canadian Partnerships Against Cancer, Canadian Diabetes Strategy, the Aboriginal Diabetes Initiative, the National Lung Health Program, and the Canadian Heart Health Strategy and Action Plan. And as well, in addition to that, the FPT, as I stated earlier, that endorsed a declaration on prevention and promotion in September 2010, which gives priority to the promotion of health and the prevention of disease, disability, and injury. Through the Age-Friendly Communities Initiative, we're also working with the provinces and the territories to bring older Canadians into the planning and design of their communities to create a healthy, safe, supportive environment where they can live and thrive. So those are examples of initiatives. Thank you.
Thank you very much, Minister. We'll now go to Dr. Fry.
Thank you very much, Madam Chair, and I want to thank the Minister for coming to answer questions today and to discuss the supplementary estimates. I wanted to go straight to something that my colleague Libby Davies talked about from the NDP, and that is that I see on one of the major points made by the Minister is that maintaining a healthy weight and a healthy diet, as well as doing regular exercise, will ensure that the numbers of health-related issues in this country, including chronic diseases, go down. Well, the Minister then went on to discuss the importance to the healthcare system of decreasing chronic disease and of managing chronic disease well. And the Minister also spoke about signing a health promotion and disease prevention initiative and focusing on that. So I know that, as the Minister said, there's more than 10 ways to skin a cat, but the only really important way to skin the cat is the one in which evidence has proven is the most effective way to skin the cat. We know that the most effective way to get healthy weights in this country and to bring down chronic diseases, such as diabetes caused by obesity, such as chronic heart disease, is to look at three very important issues, and they are salt, they are trans fats, and they are sugar. And the Minister has absolutely in her power the ability to mandate those amounts. Her own department has told her so. Advisory committees have told her so. All of the healthcare providers she's met with has told her so. I'd like to know why the Minister doesn't follow evidence-based decision-making in her department, because it would seem to me that all of this is just a lot of talk that we've been hearing since 2006, and nothing has been done to deal with this most significant issue. So I would like to know why the Minister has absolutely in her power the ability to do this and has done absolutely nothing about it. The second thing that I wanted to ask the Minister is she talks about money being spent on HIV/AIDS for vaccine, and this is good. This is very good. But is the Minister aware of the fact that in British Columbia there is a proven, evidence-based, again, drug that will not only treat the patient who has HIV, but will, by the second dose, bring down the viral load so completely that HIV will be prevented from now on? If I cannot think of a better way to look at something in place of a vaccine while you're waiting for a vaccine, that's the way to do it. And I would hope that the Minister would work with provinces to talk about a way of ensuring that this is part of a major HIV/AIDS strategy. It's called the HEART program. British Columbia is spending $18 million a year to treat every single person who is HIV positive. This is smart, evidence-based way of doing things. So that's the second thing I wanted to ask the Minister about. The third thing I wanted to ask the Minister about is she talks very much about the Crown and First Nations model of health governance. So I would like the Minister to tell me, since the money for the Aboriginal Healing Fund was transferred from the Aboriginal communities themselves into Health Canada, can the Minister give me an update on how that Aboriginal Healing Fund has progressed within Health Canada? How much of that has gone to actual Aboriginal communities to work on healing, to make a difference? Because, in fact, INAC had originally told us that it was so effective that they had hoped that this fund would continue within Aboriginal communities. So Health Canada should give evidence to me about the outcomes that are better than the Aboriginal Healing Fund's outcomes when they happened. And finally, personal health. The Minister talked about a genetic profile and that you cannot pick different things to solve a problem. Well, does the minister believe that the genetic profiles are the only things that cause disease? What about poverty and unemployment? What about the environment? What about smoking? What about obesity? What about alcohol? Those are the things that also create disease, not merely your genetic profile. So if the minister has that kind of money to spend, I would like to know why the minister isn't dealing with bringing down chronic diseases.
Buka?
Just on the issue of the sodium conversation, our government has taken a number of steps to help Canadians make healthy food choices, including the mandatory nutrition labeling that requires that sodium content be declared. We've also revised the Canada's Food Guide, and consumer information on Health Canada's website is also available. We also released a national sodium reduction message in October 2011. The provincial and territorial and federal partners, in collaboration with industry and health and other stakeholders, are working together to lower the sodium intake of Canadians to 2,300 mgs per day by 2016. We are on target and we are moving forward. Health Canada, with its partners and stakeholders, is moving on 3 fronts to reduce the sodium consumption, and that includes education and awareness and guidance to industry on efforts to reduce sodium in processed food and research.
All the respect in the world,
the sodium
could you answer my
reduced
question
diet
about
is
why you've not gone to mandatory?
Of broader efforts to improve the healthy outcome. So we are moving forward in the area of sodium reduction. In the area of tobacco, it was this government who introduced the legislation. My first legislation was to deal with the big tobaccos marketing their products to children. That legislation was passed, and we've seen a significant reduction in young people smoking in this country. It's the lowest it's ever been. We're quite proud of that, and we continue to move forward in tobacco warning labels as an example. We are working with the provinces and territories to combat this issue. And again, this is a collective efforts of provinces and territories in reducing smoking of our young children. In the area of evidence-based HIV, I think the initiatives that we have undertaken in partnership again with Bill and Melinda Gates Foundation is to poll the experts in developing a vaccine. After 25 years of doing research in areas of HIV, we were concerned that the investments we're making was not resulting in the production of an HIV vaccine. So we pulled together the experts in partnerships with Bill and Melinda Gates Foundations to focus the experts and the resources that we do have in coming up with a vaccine. And this is, again, an innovative way of dealing with moving forward in addressing the issue of developing a vaccine for HIV/AIDS.
Thank you, Minister. And now we'll go to Mr. Gill and Mr. Brown. Mr. Gill will begin.
Thank you. Thank you, Madam Chair. I also want to thank the Minister for taking the time out of your busy schedule and being with us here today, and also all the officials. I also had the opportunity to participate in the drug shortage debate that we had last night, and I want to thank Health Canada for the role you're playing, and also under the leadership for the Minister for doing a tremendous job, and I have a full confidence that the issue at hand will be addressed in the very near future. My question, Minister, is for you, related to obesity. Canada is facing an obesity epidemic, and I understand that addressing childhood obesity is a complex problem, but I believe it is critical that we do so. I believe that all sectors of society, all levels of government, will have to work together to find the solutions. I understand that you recently participated in a summit on healthy weights. What was that all about, and will it help us to address this issue at hand?
I thank you, and thank you for participating last night in the debate. Reversing the trend in childhood obesity is very important. The World Health Organization declared last year that obesity is an epidemic, global epidemic, now, not tomorrow, today. As you've mentioned, it will require an action from all sectors and society, of all levels of government, the private industry, the communities, the families, and individuals. And I'm very happy to say that all of these groups were at the summit that I hosted this past month. We recognize that we all have to work together, and that was the key point at the summit. And I am therefore happy to say that Canada's Ministers of Health made the commitment to also work together with other sectors of society to address the issue of obesity. The summit was another important step in creating the conditions that will help children, youth, and their families achieve healthy weights. It was an important step in continuing our efforts to take action across sectors to reduce childhood obesity in Canada. And I followed, it followed the national dialogue on healthy weights called Our Health, Our Future, held last year. And the dialogue engaged Canadians in a conversation about approaches to tackling the obesity challenges that we face. The summit also challenged us all to think outside the box. We laid out the foundation of new ways to promote healthy weights, and we owe it to our children and our youth, and we must give them the healthiest possible start in life. So this conference was historic, but I can say that there are great initiatives occurring across the country in partnerships with provincial and territorial ministries in addressing the issue that we're seeing in Canada, the epidemic that we are seeing in Canada around obesity, and this conference was the first of its kind to address that very important issue. Thank you.
Thank you very much. I'd like to now share my time with Mr. Brown.
Minister, a few years ago you had a chance to meet an individual from Barrie by the name of Derek Walton, who had been living with ALS for 8 years. And I know Derek's part of a growing number of Canadians that have neurological disorders. The Rising Tide report from the Alzheimer's Society certainly illustrated that neurological disorders are becoming a greater challenge for our healthcare system every year. And I know I think most parliamentarians were very impressed with the $100 million brain trust that this government announced, and wanted to see if you could outline a little bit what that's going to mean for our battle against neurological disorders in Canada.
Thank you for your question. As you know, this is Brain Awareness Week, and I'm very pleased to speak on our efforts to support brain research. This government understands the importance of brain research for the 1 in 3 Canadians who will be affected by a mental disease or disorder in their lifetime. Diseases such as Alzheimer's, Parkinson's, and spinal cord injuries lead to a profound deterioration of quality of life. Equally important, they have a profound impact on patients, families, as well as caregivers. We are committed to supporting research and initiatives to continue the research for new treatments, prevention, as well as cures, and we are committed to supporting initiatives that could eventually relieve social and economic burdens and relieve suffering. The CIHR makes significant investments in neuroscience and mental health research. For its part, Public Health Agency of Canada adds to the understanding of brain disease and mental disorders by also administering the National Population Study on Neurological Conditions. Canada is regarded as leader in neuroscience, and we've signed an international MOU with France, Germany, and the UK on Alzheimer's research. Our universities pursue world-class and cutting-edge research, and our NGOs, such as Brain Canada, are establishing a strong infrastructure to support research in this area. But we also understand that more can be done. Thank you.
Assuming I've got a little bit more time? No, all out? Okay.
Time is pretty well up. Thank you, Mr. Brown. We'll now go into our second round, 5-minute Q&As, and we'll begin with Ms. Kuesh.
Merci, Madame la Présidente, puis je remercie Madame.
Thank you, Madam Chair, and I thank the Minister for having come to this meeting this morning in order that we might discuss the estimates and the health budget. I thank her for having participated in the debate last evening on the scarcity of medication on the motion moved by my colleague Libby Davies. The debate was kind of without any accomplishment because the government seemed to have been relinquishing all responsibility. But the minister stated yesterday that she wanted to work to accelerate the process for approving these new suppliers in medical drugs. In spite of all this, there is a scarcity of drugs, and it has become a recurring issue, not only in the province of Quebec. According to the National Institutes for Excellence in Health, in 2010, 116 scarcities occurred in Quebec. So we really have a real long-term issue for this, which should include greater regulations, and the regulations that has been asked for by many provinces and by many health experts. In the past few days, they have spoken to the media, Francophone and Anglophone, throughout the country dealing with this issue. So therefore, it's important to state that in the speech given by the minister this morning, one speaks about maintaining health for Canadians and giving information, and so that enlightened decisions might be taken. But in spite of all this, there seems to be always blaming the provinces and the drug companies when the federal government has a responsibility to see to the health and safety of treatment being given and to find the tools necessary to strengthen the health system. And this is really included in the minister's speech. And in spite of all this, the federal government isn't obliging pharmaceutical companies to report scarcity. We know that should there be a voluntary system, broadcasting all the details has not given the expected results because we're still faced with a scarcity of drugs at the moment. Now, we know full well that there's all kinds of technical problems, fires, what have you, can occur in industry. And it's not always the companies that make this information public. The companies choose what kind of information is to be broadcast to the public, and therefore many provinces and health experts cannot get the information. And the proof of all this is that it has taken many months before people in Quebec got the information that they required on the slowed up production in the Sandoz firm. Now, we should prevent rather than to reacting catastrophically to events that occur on a regular basis, even though this might be spontaneous. It seems to me that there should be an ongoing permanent coordination between the provinces, the federal health experts, the suppliers of pharmaceutical products to ensure that there is continuity in the production chain. Now, what do you expect to do concretely to prevent other scarcities in the future? Is it not time to show leadership now, a leadership that has been asked for on all sides, and to avail yourself of a compulsory system to broadcast this information with respect to medication?
Thank you, Madam Chair. I'm going to start off and then pass it on to my officials who has been working with the provinces and the territories and the industry to respond to the latest situation that we're dealing with Sandoz. As I stated last night and in a number of conversations, we need to work in partnerships with the provincial and territorial health ministers on this very issue. We cannot ignore the fact that the provinces and the territories deliver health care. My job is to work with the jurisdictions in providing support to responding to the situation that they find themselves in. Through this process, as I stated last night when we started dealing with the issue of Sandoz, we provided to the provincial and territorial health ministries a list of companies in Canada that are already approved to produce the drugs that Sandoz can no longer produce. That information was provided to provinces and territories, and it's up to each jurisdiction to move forward in purchasing them. The other thing that needs to be very made clear again, in that there is provinces and territories deliver health care, They provide services to their citizens. They know what drugs and products they use for their population. At the same time, they have a contract with industry to determine what those contracts are. I do not have access to the provinces and territories' contracts with their drug suppliers, whether there's a provision in the contract or not, where if there's a provision in the contract for the industry to provide notice to the province when they're going to shut down production or slow down production or not going to be able to provide drugs, that question needs to be answered by the provinces and territories. They have the contracts. I do not. So our role has been to provide the support to the provinces and territories in identifying the other companies in Canada that they can go to. At the same time, we have a process in place within Health Canada as a regulator to be able to move very quickly on approving drugs in Canada that may be a need for each jurisdiction. And a lot of work has gone into this process, and I will have
yes, Dr.
Paul
Fry.
Glover elaborate a bit more on
Sorry,
that.
Minister,
Chair,
my apologies.
The minister has been kind enough to come here, and the reason that the minister is here is so that she can answer questions put by this committee on issues that we consider to be of importance. I think it is inappropriate for the chair to continue to stop a member of this committee who feels that her question is not being answered and wishes to redirect the question to Madam Chair. The minister cannot respond if I'm making a point of order.
Dr. Fry, this is no point of order. I'm sorry, you are finished.
My point of order, Madam Chair.
We'll now go to Ms. Block. Mrs. Block, you're next. Thank you. Would you shut Mrs. Thank you.
Thank you very much, Madam Chair, and I would like to welcome all of our guests here today, as well as our minister, and to thank you for the very good work that you're doing on behalf of Canadians. As you are aware, in the spring of 2010,
I brought up a point of order. I did not get a response from the chair.
In all due respect, you're talking over me. Dr. Fry, you do not have a point of order.
Madam Chair, while I'm speaking, I would really appreciate it if you would allow me to finish my sentence. If the chair is saying that I am not in order, then I
Dr.
would
Fry,
challenge
could you
the chair.
state which standing order or practice you consider to have been breached right now for your point of order? Could you tell me what that is?
Madam Chair, this is not really about a breaching of anything. It's about
You do not have a point of order. You
behind
can't
you're not
just talk right
allowing
now.
questions to be appropriately asked. You intervene every time a questioner is asking a question.
The
and
minister,
you continue to stop the process
the
from
members
actually occurring,
have a
Madam
certain.
Chair.
Dr. Fry, I'm trying to explain this to you.
Well, I would like to finish my sentence, Madam Chair, because you speak over me. And I don't think that's very polite or appropriate.
Well, because
when
you
I
keep
make a
going
point
on
of
and
order,
on
I
without-
expect you to listen
without
to my
stopping.
point of order,
And
at the
everything's
end
being
of the
held
point
up.
of order, you can then respond. That is how it works. And I would appreciate it if the chair would understand that what she's doing by intervening every time someone wishes to clarify a question with the minister, the chair intervenes. And this is an inappropriate way of dealing with the whole
Rulings are
concept
not
of question
subject
and
to
answer.
debate, Dr. Fry. We'll go to Mrs. Block.
thank you very much, Madam Chair. As I was saying, you are probably aware that in the spring of 2010, an all-party parliamentary committee on palliative and compassionate care was formed after a private member's bill was defeated, which called upon the government to legalize euthanasia. Obviously, this committee was formed as a response to recognizing that it was not enough to just defeat that bill, but that we needed to take a look at end-of-life care and providing compassionate care to those who were in a palliative state. This past fall, a report was published called Not to Be Forgotten, and it focused on palliative care, suicide prevention, and elder abuse. And I guess my question for you, Madam Minister, is what is our government doing in regards to advance palliative care for Canadians?
Thank you. Thank you for that question. Health Canada works with a range of palliative care experts and other stakeholders on initiatives to enhance Canada's capacity to provide quality palliative and end-of-life care. We're investing in the establishment and implementation of the national quality standards for palliative care services. We're helping to ensure that all doctors, nurses, and social workers graduate with the core knowledge of how to care for people at the end of life. We have been investing money over the past decade to also foster the promotion of knowledge sharing and public awareness, and we invested significant funds through the Canadian Institute of Health Research to help build capacity for palliative care research across Canada. More recently, this government is pleased to provide a one-time funding of $3 million to support the development of community-integrated palliative care models. The provinces and the territories are primarily responsible for the delivery of palliative care. While the federal, provincial, and territorial governments have their respective areas of responsibilities, our collective goal is to facilitate access by Canadians to quality palliative care services across a variety of settings. Thank you.
Thank you very much. I also know that you mentioned in your opening remarks the issue around the debate that's been taking place publicly around multiple sclerosis, and we know that Canada has one of the highest rates of MS in the world. I come from Saskatchewan, and I'm sure you're aware of the work that our provincial government is doing in terms of clinical trials, providing some funding for that. And I know you spoke to it and probably couldn't cover everything in the short period of time that you had to make your opening remarks. And I just wanted to give you an opportunity to expand further on the work that our government is doing, perhaps even on the monitoring system that has been initiated.
Okay. Thank you for the question. Multiple sclerosis, or MS, is the most common neurological disease affecting young adults in Canada. Every day there are 3 or more people in Canada are diagnosed with MS. In fact, Canadians have one of the highest rates of MS in the world. Our government knows that action is necessary, and that is why we are funding research towards more effective treatment and ultimately a cure. We have invested about $55 million in MS-related research to date. We are also investing more broadly in neurosciences and stem cell research, areas which are increasing our understanding of neurological diseases and expanding the potential for therapies. We have made significant investments in neuroscience research and stem cell research in the last couple of years, and the funding is supporting our top health researchers, such as individuals like Dr. Weiss of University of Calgary, whose fundamental research in the area of neural stem cell has been built upon by the neurological researchers, not just in Canada but around the world. Based on the advice of the scientific experts, our government decided in June of 2011 to proceed with clinical trials to test the safety and efficacy of the CCSVI procedure. CIHR is currently selecting the research team that will conduct this clinical trial. The funding for the study will start as soon as May of this year. We're also establishing a monitoring system to capture better information on MS patients, including those who go outside of the country for treatment. The monitoring
Minister.
system.
I'm sorry, we're running out
Okay.
of time, and sorry to interrupt you. Dr. Sala. Oh, sorry. I'm sorry, Dr. Sala, I didn't
Sorry.
notice. Merci, Madame la Présidente.
Thank you, Madam Chair, and thank you to the Minister and the officials for having come to appear before the committee this morning. already with what is at stake and has been raised by my colleagues, such as the shortage of drugs. This is a subject matter for which we had called upon the minister to answer such questions when she last came to us, and the issues such as salt reduction and energy drinks. I have difficulty to believe that public health is a priority of this Conservative government. This Conservative government has always been very clear. They asked the various departments and federal organizations to draw up scenarios to reduce their budgets by 5 or 10%. You have received various scenarios that the government has prepared, and you are merely awaiting the March 29th budget to find out to what extent your budgets and your employees will be affected. At a point in time when this committee has heard, in many instances, testimony referring to a promotion for health and disease prevention, and that it speaks about the first role of Health Canada in preventing many illnesses and physical conditions, I'm worried of upcoming cuts in your budget, Madam Minister. The agency has already spoken about an investment when they appeared before the committee. For that matter, they spoke about a preschool assistance programs for the Native people in our northern community. This is of the utmost importance to my mind when we know to what extent our Native people have been affected by chronic disease much more than the rest of Canadians. My question, therefore, is this: can you guarantee this committee that Health Canada will not cut these programs after the budget is brought down on March 29th? And if not, how can you assure us that it will be able to fulfill its mandate when the committee has heard many witnesses on the importance of prevention and the role to be played by the agency on this matter?
Minister, I'm sorry, we're just about out of time. I know you have to leave at 1:45, so just if you could respond to Dr. Sala's question.
Okay.
Thank you.
Thank you. I think our government has made it very clear to the provinces and the territories that deliver health care that we would not cut health transfers to respective jurisdictions, and that's been made very clear by the finance minister when he met with the finance ministers in British Columbia, that health transfers will not be cut. In fact, they have predictable and long-term funding that each jurisdiction that deliver health care can use to do their own planning down the future. In terms of Health Canada, along with the federal departments and agencies, we have been engaged in efforts to support a Government of Canada's goal to return to a balanced budget. When we developed our cost-saving proposals for this government, we took a close look at how we conduct our business and how we can best continue delivering our core mandate of protecting the health and safety of Canadians. Departments were asked to provide the proposals, and again, the final decision will be made when the budget is delivered this month. Thank you.
Well, Minister, we all want to thank you so much for attending today and for your very thorough answers. And I know that the department is going to stay and continue to answer questions. So I will just suspend for a minute to allow you time to get to your further duties. But thanks again. We really appreciate it.
Thank you.
We'll suspend for 1 minute and then we'll start up again. much to the Health Canada representatives and the representatives from the Public Health Agency, and we will begin. We'll give the presentation has already made by the minister, so what I'm going to do is just go straight into the questions. And I think that's fair enough. We'll give more time. Does the committee agree to that, to just go straight to the questions rather than any more presentations? Okay, we will begin with Dr. Morin.
Thank you very much. So my first question will be, the residential school system represents a shameful part of Canada's history, and we've since been forced to apologize for. While the government apology was certainly historic, its actions since then have done little to improve the lives of First Nations in Canada. Like with many things done by this government, their words are sadly louder than their actions. As a result of continued government inaction, the suicide rates in Aboriginal communities are reaching epidemic proportions in some regions of Canada. Survivors are angry and outspoken. They expect Ottawa to work with them to find long-lasting solutions for themselves and their children. Enough is enough. When will this government stop wasting everyone's time and finally implement the recommendation of the Truth and Reconciliation Commissions on the extension and enhancement of health support services?
Ms. Yates?
Thank you. I think this is a very important question that the member raises, and I think we are all very much focused on providing the kind of supports for communities and for individuals that we know are needed. There are two things that I would mention in response to the member's question about what we're doing at Health Canada as part of this process. Budget 2010 expanded 5 years of coverage, essentially, for a series of prevention programs in a number of areas, including mental wellness, early childhood development, and youth suicide prevention, for example. So we have a number of programs that are working across the country. Some are in very targeted communities. For example, on youth suicide, we're working with 160 communities very specifically on this issue to try to provide the kind of prevention and support to communities. And it varies community by community. Our regions work with individual First Nations and the people in those communities, and in some cases the AFN and others, to try to tailor the supports that are needed. But the member also raised the issue of the Truth and Reconciliation process, and we are working very closely with that process to provide the supports that we know are needed. As individuals come forward as part of that process, they themselves do need support, and we've been working very closely to provide those supports. So when the Commission, the Reconciliation Commission, is in a centre having discussions, hearings, we are very much there providing both professional, health professional supports, but also traditional supports. And we are, I think the court has indicated we must provide those. We are working very hard, and I think I've had some very good comments on the support that we're providing under some very challenging circumstances, obviously.
Alors, est-ce que le ministère de la Santé va
Well, therefore, will the Department of Health implement the 3 recommendations that have been made? Will the Department of Health implement those 3 recommendations from the Truth and Reconciliation Commission? I don't have the recommendations in front of me, Madam Chair. But, of course, indeed, we are working in very close cooperation with the Commission, and we will see what the recommendations are and do our utmost to support people, those who are in need of such services. Thank you. Following up on this theme for our Native peoples, in the main estimates for 2012-2013, we've noticed a 20 million reduction in the budget for First Nations and Inuit primary care. I find that somewhat surprising when we're speaking about 184.5 million last year to 665 odd million this year. This decrease of 20 million, is this a relinquishing of duties as to the priority for Native peoples in Canada? We saw it with Attawapiskat It's not the needs that are lacking. So therefore, why would you tell us that the Native peoples are not entitled to this $20 million this year? Maybe it should be allocated to the F-35s. Thank you for the question, and it's very important for us to know that we are very, very much geared towards giving primary care in the Native communities. That is part of our mandates, and it's an important issue for us to give such services. There are Native communities that have that are very close to what prevails in urban communities, and they should be able to use provincial services. But many of our communities are so far removed that we have to support health services of a primary nature for those communities, and we do so in conjunction with the Native communities. I want to reassure these communities that there has been no reduction money-wise in that particular situation.
Supplementary estimates. In fact, before the committee today are both the main estimates for the following year and also supplementary estimate C, which is the last set of estimates for this year. Because the primary care services are very important, we sometimes adjust them from year to year, and we would typically review those, and those would come later in the supplementary estimates. So just as last year, I think the committee raised the question, not all of the monies for our primary care, nor some of our other programs were in our main estimates. Those are things that we review the precise need levels and then adjust. So we can assure the committee that there is no reduction planned in primary care service levels, and this really reflects a budgetary process rather than a diminution of service.
Mr. Stroll.
Thank you very much to all of the officials for being here today. My question is about the medicinal marijuana directorate, the system that Health Canada has responsibility for. In my riding, includes the city of Chilliwack, and it's a very big issue in my community, medical marijuana being grown in residential settings. The local government is very concerned, that they aren't allowed to really know where these things are, and about the threat to public safety when there is when a medical marijuana grow up is found. That we're now finding that organized crime is becoming a problem. They're latching on to those folks that have a license. There's concerns about neighbors being misidentified as having a grow up. I was encouraged to hear the minister's initiative to make it easier for patients to go straight to a doctor and get prescribed medicinal marijuana, but I was also encouraged that we were looking to move medicinal marijuana grow operations out of residential settings altogether. So I'm hoping that you can provide the committee with an update on that program and perhaps give us some timelines of when we can expect. I know the consultation period has ended, but when might we expect to see the plan so that communities like Chilliwack and others can know what the future holds for that program?
Who would like to take that particular question? Ms. Yates.
Yes, this is also a very important program within Health Canada, so I'm very pleased to bring the committee up to date in terms of the progress. As was mentioned by the member, there are a number of concerns that we hear as well. I would say they fall into two categories. In the one case, individuals are often concerned about, are we able to approve their requests in a timely way? And I will be happy to report to the committee at this time that we have the number of users has been growing significantly, so we have staffed up, and we are in fact meeting the our guidelines, our timelines, which is less than 10 weeks for approvals. We are now in a position, and I'm happy to report to the committee, that we are doing those in a timely way. So that's one set of concerns we often hear, but the other is the one that the member raises, which is have we got the right model, essentially? And as was mentioned, we have been hearing concerns about the program perhaps being open to abuse or exploitation. We've heard concerns about from municipalities and police or fire officials. And that's the reason why, in a sense, we've put forward for public consultation a proposed set of changes that would look to perhaps treating medical marijuana more like we treat other medications, for example. So we've put that proposal out for consultation. We had a number of very excellent comments back. We've been doing focus groups as well. So in addition to the public consultation, we wanted to make sure that we heard specifically, for example, from physicians, from municipalities. We've been talking to the provinces and territories. So we're trying to make sure that we get that input as well. And now we are in the process, those two processes of consultation have basically just wrapped up, as was mentioned, and we're now in the process of working through what we heard in response to the proposal that we put out. But I think it's fair to say that once the government's considering that, it will then make its decision about how we move forward. I think we're also thoughtful that this will not be something, if we do make a change here, as has been proposed in our consultation document, it won't be a change that is immediate. It will take some time to transition from one system to another, and we're also thoughtful about that as well. So in terms of timing, we're pulling together the analysis now. Once the government makes the decision, obviously part of that will be what is an appropriate way to transition from one system to another.
My second question, quickly, we've met, a lot of members here have met with firefighters. I know the fire chiefs will be here again tomorrow. Question they've raised, maybe this is for Dr. Butler-Jones, they've raised concern about the priority for vaccinations in perhaps like an H1N1 situation, that they weren't considered in the first priority round of immunizations. I'm just wondering what goes into that decision-making process, that ranking, and if any thought has been given to first responders like firefighters, getting them moved into that top rung.
Yes. Anyways, thanks very much for the question, because it's one of those eternal questions. Basically, the principles that underlie the recommendations in terms of priority are those who are most likely to be seriously ill or die, so protecting life, and then protecting essential functions. And so clearly police, fire, first responders, essential services, etc., come into the category of obviously essential services and the trying to minimize disruption in the face of an outbreak, etc. With H1, clearly firefighters, others who were at risk of severe disease, obviously were in the first tier. But what we found is that people of that age, it was not actually a threat to civil society. If it had been, if in fact they were either at greater risk or there was an issue of access, then clearly they would have moved up the queue. We also had antivirals which were very effective. So early treatment, what we found, was particularly effective during the pandemic. So even if somebody, a firefighter, doctor, or whatever, if they became ill, getting immediately on treatment shortened the duration and reduced the severity as well. So there was, as we saw, there was no, as it turned out, we were able to manage that without changing the priorities, ensuring that those who are at greatest risk of getting severe illness and dying had first access. And actually in Canada, we essentially wiped out the pandemic before Christmas, which no other country can say.
Thank you.
Thank you so much. Dr. Fry.
Thank you very much, Madam Chair. I wanted to go back to a question I'd asked earlier, and I wondered if you could give me some information about what the outcomes are in terms of the Aboriginal Healing Fund since it has been transferred to Health Canada and moved away from the Aboriginal communities. As you know, it has proven to have been a very successful program within Aboriginal communities, and in fact, when the evaluation was done by the Department of Indian and Northern Affairs, they decided that it should have stayed there. So I just wanted to know if that move has made health outcomes better for Aboriginal people, how many programs are they having access to, is the whole fund being utilized? That's the first question. And then my second question is for Dr. Butler-Jones, and it has to do with the HEART program, as you know, in British Columbia, with regard to the treatment as prevention. That was the new drug that has been devised. And in fact, it's a Canadian celebration in that Canadians have actually been the ones who have brought this drug forward. And the World Health Organization thinks that it is the best step to make in preventing the HIV infection and in actually dealing with the problem from stopping prevention of the transformation, et cetera, et cetera. You know what I'm talking about, and so perhaps you can answer me about that. Yes.
Thank you very much for the question. And as I mentioned earlier, I think the issue of support for First Nations clients in terms of mental health services and healing is very important. I should clarify that the Aboriginal Healing Foundation funding was not transferred to Health Canada. It was always intended to be a time-limited program. It did, in fact, reach the end of its time limitation and was not renewed. That is certainly the case. But, in fact, what we have done as that programming wound down is try to reach out to the communities who, in fact, had projects that had been supported by the Aboriginal Healing Foundation to try to connect them to the services that I mentioned that we have within Health Canada. So we do, the funding wasn't transferred, but we do, in fact, have programs in terms of mental illness and suicide prevention and support programs. We also have the programming under the Aboriginal, or rather the Indian Resolution, Schools Resolution Health Support Program. So that's where we have specific money tied to that process, and in fact we've tried to make sure that we are linking individuals and communities with that process as well. So that's the activity that we've been doing.
Again, thank you for the question. The treatment as prevention, and basically it's actually an old concept, which is secondary prevention. So the early identification and treatment to minimize the impact of any disease, whether it's through screening and then early treatment, or in this case with HIV/AIDS, the recognition. And it's come clearer in the last while with Julio's and others' work in Vancouver that is an effective way of doing it. But it's one of a series of measures. It's not a substitute for not getting infected in the first place. But clearly identifying people being able to come forward to get diagnosed, to get appropriate treatment is one part of that. Even in some parts of the world, circumcision is a primary prevention. And the development of vaccine ultimately will be the ultimate in dealing with it. But it really requires a focus on primary prevention, in other words, not getting infected in the first place, early diagnosis and treatment for those who are infected, and appropriate care for what's becoming a chronic disease.
I realize that is a spectrum of how public health would look at an issue, but my knowledge is that this new drug actually brings the viral load down to zero for as long as that drug is being taken, so that the patient is not able to pass on HIV. That's a significant new development. It is almost as if you've given the person, almost, but you know what I mean. But this is not simply secondary prevention. This is actually a new drug that is dropping the viral load to zero.
But it does not cure the disease. It is secondary prevention, and if I may say, it's a very important thing, but it's not a substitute. And in clinical trials, well-controlled clinical trials with close follow-up, we know that it does work. In a population level, where people sometimes take their drugs, don't consistently take their drugs, it's not a substitute for not being infected in the first place.
No one is suggesting that. I'm saying that while you're waiting for your vaccine, it is a way.
Oh no, absolutely, and we're actually
bringing down transmission to zero.
Absolutely, and we're very much supportive of that identification and coupling it with all the other measures as well. It's a very important finding. There's no question about that. It is not the answer to HIV/AIDS, though. Ultimately, it will be a vaccine.
No, and I'm not asking you about the answer to HIV/AIDS, Dr. Butler-Jones. I'm just asking if you think that this is something that you could utilize because of its importance in, say, Aboriginal communities or the groups and the cohorts that the federal government is directly responsible for in terms of health care. I mean, this would, given that the World Health Organization has endorsed it as the thing to do currently, right now, to bring down spread of HIV/AIDS. I'm wondering if you would think of doing it within the RCMP, the Aboriginal communities, Inuit communities, et cetera, et cetera.
Clearly, it's one of the options. I wouldn't go so far as say the WHO says this is the one thing. It is an important tool, and it really requires assessment in the right context for how you're using it. It's very promising. I'm not arguing with you. It's very promising, but it is not the only answer.
Okay, thanks.
Just less than a minute, but I guess it's probably not time for you to do anything, Dr. Fry. We'll now go to Mr. Brown.
Just briefly, I know we're running short on time. For the CIHR, I've got a constituent, Greg McGinnis, who runs our local Parkinson's chapter, and I just wanted to know on his behalf what type of allocations are we making for Parkinson's research, and what type of progress are we making? I know that the CIHR has made a focus on neurological disorders, which is wonderful to see, and that was my question to the minister, but I spoke to her more in general terms about neurological research, but in particular for Parkinson's, what type of progress are we seeing in Canada, and are we making any allocations this year?
There are people from CHR can speak to their actual efforts. If you don't mind a minute, Patrick. Thank you.
Thanks very much for the question. For this year, I have the numbers from 2010-11. We have committed $8,706,000 to Parkinson specifically.
Perfect. And do you have any information on the type of research we're funding for Parkinson's?
I don't have that with me, but I can get it for you and provide it.
Thank you.
Thank you so very much. And now we're just going to go directly to the voting on the main estimates. I want to thank our members for being here, our witnesses. And did you have something, Ms. Davis? I'm sorry.
Just before you go to the vote, I know the supplementary estimates are in effect done, so we're not really dealing with that just as a matter of information. So we are dealing with the main estimates, and they actually don't have to be reported back till the end of May. So what I would like to suggest, and I will move, is that we defer the voting on the main estimates, because we know that the budget is coming up. And based on what we see on the budget as it impacts healthcare, I think it's possible that we may want to call back the minister relative to the budgets as it affects the main estimates. So I'd like to move that we defer that, because we will still have an opportunity to vote on it later.
Any comment on that motion? Dr. Carey?
Well, it is unusual. I think we would like to actually vote on the estimates today. Thank you.
All in favor of voting on the estimates, raise your hands.
Go ahead. Yeah, so the motion would be that we defer voting on the estimates until after the budget to allow the committee the opportunity to invite the minister back should there be issues arising out of the budget as it relates to the estimates. I hope that's clear.
Okay, thank you, Ms. Davies. Yes, it is. Is that clear to everybody? Let's go to that vote. Is there everyone?
I'd like a recorded vote, please.
Recorded vote. Everyone in favor of Ms. Davis? Okay, you go ahead. Good. My pleasure.
Ms. Davies? Yes. Monsieur Morin? Oui. Madame Quash? Oui. Madame Sella? Oui. Dr. Fry? Yes. Dr. Carey?
No.
Mrs. Block?
No.
Mr. Brown?
No.
Mr. Gill?
No.
Mr. Lobb? Mr. Straw?
No.
So it's defeated.
Motion's defeated. Thank you. We'll now go to the voting on the main estimates. Shall vote one carry? All in favor?
Can we do it on division?
If you want to. On division, all in favor, raise your hand. We'll let you go do the voting.
No, it's fine. It's on division.
On division?
Yep.
Okay.
Next one.
Shall vote 5 carry?
On division.
On division? All in favor? Carried. Shall vote 10 carry?
On division.
On division? All in favor? Carried. Shall vote 15 carry? On division? All in favor? Carried. Shall vote 20 carry? And on division, all in favor? Carried. Shall vote 25 carry? On division, all in favor? Carried. Shall vote 40 carry? On division, all in favor? Carried. Shall vote 45 carry? On division, all in favor? Carried. Shall vote 50 carry? On division, carried. Or all in favor? I'm getting in the swing of this. Shall vote 55 carry? On division, all in favor? Carried. Shall vote 60 carry? On division, all in favor? Carried. Shall I report the main estimates 2012 to 13 to the House? All in favor? Carried. Thank you so much, and thank you to our witnesses today for joining us. We will now go in camera for a business meeting, so I want... I'll suspend for 1 minute. Thank you.